This computer. Okay. Hello, 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 everybody. Come on in, come on in. Thank you. Thank you for coming and being with us. We're grateful for you. I know this is Friday evening, and many of us are getting ready to get off of work. And so we've got good plans for the weekend. If you're like me, I've made a decision that I'm gonna move out of my room and go in the kitchen, and then I'm gonna go downstairs and go outside for a minute and come back in so I can be back in my room. Those are the big plans I got for the weekend. And I know you've got some big plans for the weekend as well. We're still waiting on Dr. Hollis to get with us. We got Pastor Onque with us already. We want to give it just a few more minutes for others to arrive. We still got numbers coming in. Thank you all for being with us, those who are with us already. I'm not sure Dr. Hollis is with us now. Doc, I don't know what happened there.
What happened?
There she go.
I was here, you just couldn't see me. I mean, couldn't hear me.
I just so happened to look and saw you in the panelist section.
Oh, okay.
Yeah. Hey, Melody, good to see you with us. And Joshua. Cole. Hey, brother. Helen's with us. Kyle, how y'all doing? I hope you all are doing well. Thank you all for being with us. Give us just a few more minutes, and a couple of more minutes, and we'll go ahead and get started. I just want to give everybody enough time to come on in. So just bear with us a moment. Thank you for being with us. I was just telling them, Rev, while you was away about my big plans for the weekend.
I heard part of it.
Yeah.
Go downstairs.
I'm gonna go downstairs and go out in the driveway and come back in and come back in the room. That's, got big plans.
That's the new plans, huh?
Hey, do me a favor, those who are in the audience, if you would, just put your name and location and pronouns in the chat for me. If you have questions, feel free to put your questions in the Q&A. We'll go ahead and get started in one more minute. You said what now, Pastor?
I said that's the new thing in COVID-19 environment.
I know that's right.
Come back in. Not much more than that. Yes, Lord.
That's about all we can do, man. That's about all we can do. All right. All right. We'll go ahead and get started now. We thank you all again for being with us. Thank you, Dr. Hollis. Thank you, Pastor Onque, for agreeing to be on this panel and have this discussion. We're pleased that you all are with us as well. Listen, I'm Rev Michael Malcom. I'm the Executive Director and founder of the People's Justice Council, as well as the Executive Director of Alabama Interfaith Power and Light. We're grateful for the Union of Concerned Scientists, as well as Faith in Place, which both of our panelists work for in their places, and we're so grateful for them and the information that they're bringing today. Let me go ahead and read the bio for Dr. Adrienne Hollis. Adrienne L Hollis is the Senior Climate Justice and Health Scientist at the Union of Concerned Scientists. In that role, she leads the development, design, and implementation of methods for assessing and documenting the health impacts of climate change on communities of color and other traditionally disenfranchised groups. Dr. Hollis works with environmental justice communities to identify priority health concerns related to climate change and other environmental assaults, and evaluates climate and energy policy approaches for their ability to effectively address climate change and benefit underserved communities. She develops and implements projects to document health impacts of climate change on communities of color and ensure scientific information from UCS is communicated in a culturally competent and helpful manner to vulnerable populations. Within the Climate and Energy Program, she is developing and scoping a new research agenda and strategy on climate and health, evaluating climate and energy policies aimed at reducing exposure to negative health and environmental impacts, and recommending policy approaches to foster inclusiveness and greater benefits to underserved communities and effectively address climate change. Dr. Hollis is also an adjunct faculty member as a professoral lecturer in environmental and occupational health at the George Washington University Milken School of Public Health, and has more than 20 years of experience in the environmental arena, particularly focused on environmental justice, equity, and inclusion, and the adverse health effects of environmental exposures and climate change on vulnerable communities as an associate professor in public health and as an environmental toxicologist and environmental attorney. She is a member of numerous organizations and boards, including the EPA's Clean Air Act Advisory Committee, the American Public Health Association's Environment Section, and Environmental Justice Subcommittee, the National Environmental Health Partnership Council, Special Advisor, the Endangered Species Coalition, Vice Chair and Co-Counsel, Healthy Gulf, the Trouble Magazine, and the Green Leaderships Trust. She earned a BS in biology from Jackson State University, a PhD in biomedical science from Meharry Medical College, a JD from Rutgers University School of Law, and completed postdoctoral studies at Harvard University School of Public Health. She is everything. Pastor Onque. Pastor Onque currently serves as pastor of St. Luke Missionary Baptist Church, 102 years old, historic church on the south side of Chicago. He has served in this capacity for 15 years. He is also the policy director for Faith in Place, where he does advocacy work in environmental justice. He is intricately involved in the work of justice. He works with the Clean Jobs Coalition and other environmental justice organizations. He also works with people of all faiths and social justice organizations on issues of criminal justice reform, poverty relief, and youth development. Pastor Onque holds a BS in biomedical communications. He has 16 years secular executive management experience in the arena or the area of operations and hospitality. He has held positions as 4th grade school teacher, supervisor of cashier operations, director of cashier operations, and controller. He also has certifications to facilitate in excellence in management, public speaking, supervisory development, diversity, sensitivity training in the workplace, and ethics in the workplace, amongst other management and personal growth modules. Again, thank you both for being here. And I guess I will start off with Dr. Hollis And Dr. Hollis, let's lead you in with a question, if you will, and we'll let you go ahead and present, and then we'll lead Pastor Onque in and let him present, and then we'll have a discussion. Is that all right with you all? That we talk it
Okay.
not the other way around. I think we're all right.
I think it was the other way around. I'm not sure.
Right.
You
Yes. I
ain't
think we
sure?
have some slides, but it's okay.
That's
We'll
okay. Let's
slide
start
deck
with Pastor Onque then. Pastor Onque, I could say for myself, I felt called to this work by way of a question that I heard Reverend Dr. Gerald Durley ask. He asked, how can I shout them in the pews and they can't breathe out in public? Here's my question for a pastor who's also a policy director of Faith in Place. What does the church do now that the shouting has stopped? In other words, believe in the science. How do you see faith communities' involvement in the age of COVID?
At this time, the faith community has to be instrumental in education to the members of their congregations and leaning on science and producing evidence so that they're fully aware of the risks that are involved when it comes to COVID. Clearly, there was a lack of knowledge going out to the churches early on in this COVID pandemic, where people were believing a lot of falsehoods around whether African Americans can contract COVID. We don't go to China, so we don't have to worry. But then as we started seeing COVID metastasize, we realized that it was African Americans that were largely at risk because of our underlying health issues that were in our community. We're going to talk more about that because we realize that part of historic and systemic racism that put us so vulnerable to such a virus. And so when you look at the science, it's clear now that you have clear evidence that this disease is ravaging our community, where we may be in Illinois, only 14% of the population. We are clearly at 50% of the diagnosis in the state. And then in the city of Chicago, the disparity is so much greater, where we're 30% of the members of the population in the city of Chicago. We're up to 70% of the deaths in the city of Chicago. And so the numbers really mean something. And so you have to put the numbers in front of people to let them know that this is real, this is a real threat to our community. And so I really believe it starts with education. Before you can advocate, you must educate.
Agreed. Now you had some slides that you wanted to, in a presentation that you wanted to do.
Yeah, let me show a few of those slides. We put a slide deck together, and I'll stop and then let you ask Dr. Hollis her questions, and then she'll continue with her slides.
All right, sounds great.
All right. So advocacy, COVID 2019. Quick overview. We wanted to talk about really discussions on advocacy around this being Earth Day week or Earth Week. We're celebrating the 50th anniversary of Earth Week, and this is a great time for us to come together to talk about the importance of this epidemic. So epidemics like COVID-19 emerge along the fissures of our society, reflecting not only the biology of the infectious agent, but the patterns of marginalization and exclusion, as well as discrimination. And everyone knows that Reverend William Barber, and he made that quote. And I added that in there because it's clearly something has been unveiled about how a small virus can show the world how the marginalized and the least among us have been discriminated against. And so we're in a new normal today. The onslaught of the COVID-19, we're facing a new normal. How will we continue to do advocacy in this new normal? So again, as I reflected in my answer, educate, connect, and then advocate. Staying on top of the facts. We can't be afraid of the facts. We can, science matters, even to people of faith. And so we want to use education as the key. So what are the CDC recommendations? Again, at the very beginning, we were talking about social distancing, 6 feet apart, washing your hands frequently. If you're sick, stay home, shelter in place. Again, that's our new normal. And so we want to make sure our congregations can shout at home. You don't have to be in the church house to shout. You can be in your living room and hear the message and be safe so that the disease is not spreading. And so we believe and rely on virtual connections. And these virtual connections today, I've been busier since being at home than I've ever been, because reaching out to people, doing virtual connections, webinars, FaceTiming, just connecting virtually to make sure people know that we're here and we're here for them, answering questions and being a part of panels such as this to show what little I know and what can help our communities. And so when we look at Earth Day, there must be a focus on climate justice. And we can't talk about climate justice without talking about environmental justice. And we can't talk about environmental justice without talking about environmental racism. And so this is where we know that we need to have a hot conversation. And I'm glad you have Dr. Hollis on the panel, because I'm going to allow you to ask her a question, because she's going to take it over from here, dealing with environmental racism.
Thank you, Pastor. I appreciate you for that. Dr. Hollis, I'll run right to you. In one of your recent articles, you interviewed Dr. Jacoby Wilson. You had 5 takeaways, but let's talk about one of them in particular. You talked about protecting the most vulnerable first. Can you tell us more about that as you lead into your presentation?
Sure. The reason that was the takeaway was because Dr. Wilson talked about lessons that we hadn't learned from climate change, from other climate issues like flooding and hurricanes and the like. We haven't learned that we've got to protect our frontline communities when it comes to having them evacuate areas that are unsafe, or when we know that they don't have the equipment needed to, for example, in a heat wave, right? They may, we may not all have air conditioning, or we are the majority of the people in the front line when it comes to service workers. So who will be the first to lose their jobs, right? So we need to protect that. We need to protect our frontline medical workers. We should never have not had enough personal protective equipment, and that's the sort of information he was talking about. And there are reasons for, I think that there are reasons for some of the situations that we have been put in, and that is sort of like where my presentation kind of starts. And it's going to be quick, so I'll be just passing through a few things. I'm going to just share my screen with everybody. So first, I just wanted to talk a little bit about what environmental racism is. We all have heard of it. We know what it is. It's not new. And we know that it's the most significant indicator of a person living near a contaminated facility. Now, someone asked me the other day, was it really race as opposed to income? And race and income are both important, but race has been shown to be the primary indicator. So that's something to keep in mind, that if you, in your neighborhood, if you go to the local landfill or toxic waste treatment facility in any U.S. county actually, with a mostly white population, chances are you'll probably find that waste treatment plant or toxic waste facility in a community of color. And that's because in the U.S., race is the biggest predictor. So some of the data that I wanted to just point out, what I kind of wanted to do is lead you into why you guys have probably heard this, everybody's asking for, demanding this racial data on testing and treatment. And there's a reason for that, and it starts here. And I am going to figure out how to go to the next slide. And for some reason, it's not working. I have the controls, right? It's Reverend Malcolm.
You've got the controls. I can make you a host, though.
Yeah, maybe, unless you want to advance. I don't know why.
I don't have the slides, so you have to do it. I've just made you the host.
Interesting. I'm not seeing the, okay, here we are. Let's see if this is gonna help me. Remote control. It doesn't, it looks like I don't have control. It had you and Pastor Onque have control.
Okay, well, I stopped sharing my screen, but I'll load up your slides and I'll move them for you, okay? Let me do that real quick.
I'm not sure you have all of them, but we can go with what you have.
Okay, then I'll let you continue.
I don't have control, Doc. It tells me I've got to request it from you.
Well, this is not working. The controls to advance for some reason weren't given to me. I mean, weren't showing up. So somebody suggested that you tell me what you did to share your slides, Pastor.
I just pushed my on my mouse. I just clicked the forward button on my mouse.
I'm clicking the forward button and the page up, and nothing is working. And usually you have a arrow at the bottom, and that's not there either. So maybe you can just share what you have, and I'll stop sharing. That would be great.
Okay. Mm-hmm. I love stuff that has technical difficulties.
Yeah. We've overcome those challenges throughout these past 3 days, and it still turned out to be beautiful.
Yeah, so I could just talk while we're waiting. One of the things that makes African-American communities more at risk is first, racism and historic racism and economic oppression, right? We all know about in the past, before I was born, for most of all of us were born, I think African-Americans and communities of color were placed in certain areas within certain boundaries, both real and imaginary. And the purpose behind that was to protect white privilege at the expense of communities of color. And state and local and federal policy sort of mandated that segregation, so it was legal to do that sort of thing. And one of the practices, if we can go back one of the practices that that I think was rampant was redlining, which I'm sure we've all heard of. And just quickly to explain that, neighborhoods in a number of cities were mapped and color coded based on desirability for residential use. And also for racial and ethnic demographics and home prices. And if they were green, that was the best place for white Americans to live. If they were blue, that means they were still desirable. If they were yellow, that meant they were definitely declining. And then red was hazardous. And there is how we got the term redlining. And then the practice continued with expulsive zoning. And that's where polluting facilities were deliberately targeting communities of color to locate. And because of our, in most cases, oppressed economic condition, people need jobs. And so the question was, do I take this job so that I could feed my family, or do I take the risk that I might develop cancer or I might develop leukemia or whatever? So that was a hard decision that people had to make. So we could go on to the next slide. So quickly, we've heard about what environmental justice is, and I like this definition. There's a different definition on EPA's website, but this one talks about everything that makes us who we are. I mentioned, when Reverend Malcom read my bio, he talked about cultural competency, and that means knowing the community. So all of that makes our environment, right? So whenever that's oppressed, if it's for racial reasons, if it's for for reasons based on our religion or religious practices, then that is an instance of a type of environmental injustice, a type of injustice. I usually think of environmental justice as, I explain it as an umbrella. And under the umbrella, or as part of the umbrella, you have the spokes: criminal justice, immigration justice, gender justice, and things like that. So I prefer a more broader explanation of environmental justice than that which we have been, I think, provided in the past. And I just want to underline, we also want to include paying decent wages and having safe jobs and quality schools and access to recreation. So if we can go on to the next slide. So the root of the issue, and this is a picture of a facility in Manchester, which is a neighborhood in Houston, Texas. And I went on a visit with one of my environmental justice colleagues, Juan Padas from Tejas, that's his organization. And they are surrounded by a number of petrochemical facilities. So I thought that would be a very appropriate slide to talk about environmental justice and what it really is. The whole purpose of environmental justice, which by the way was originally called environmental racism, but somebody wasn't comfortable with that terminology and it became environmental justice. And actually, I think for the most part, the same thing can be said about climate justice, because climate justice is environmental justice, because it's your environment. So climate is one of those spokes that I was speaking of earlier, but somebody was uncomfortable with that because it's okay in some instances to fund climate justice as opposed to funding environmental justice, which is really interesting. So this is it's a social justice movement. And the whole purpose of it is to protect communities of color and low-income communities from being overburdened with pollution. So it can be citizens of different races and classes, whoever experiences unfair environmental quality. So let's go next. To the next slide. So the birthplace of environmental justice is considered Warren County, North Carolina, where the government thought it would be a great idea to have 6,000 truckloads of PCBs dumped in the landfill, which happened to sit in this African-American community. So at this point, the community had had enough, and they decided to protest. And as a part of that, they literally laid in the streets to block the trucks from moving forward toward the landfill. A number of them were arrested after 6 weeks. About 500 people were arrested, and they lost the fight. And the PCBs did indeed enter the landfill, but they brought environmental justice to the attention of the nation, and that's important. Always keeping it front and center. So we can go to the next slide. I'm trying to go fast. So this is just the general definition of the environment is it usually relates to conservation issues, but the definition that the people that I work with, communities I work with use, and most people use, it's where we work, play, pray, go to school, and interact with others. So that's why I said the other spokes are like criminal justice. If you're in a safe environment, or if you don't have access to a home, homelessness is actually a social justice issue. Okay, so let's go forward. So these are going to go quickly. So okay. I wanted to this is a picture of obviously pollution, and even though right now the nation has become cleaner, most communities have not realized that, when I say realize that, I mean they haven't experienced that, right? Because remember that most of the facilities are in the community. However, we know that pollution doesn't know boundaries. It doesn't know not to go across the fence line. And eventually it crosses the tracks into the general population. But most of the studies have shown that communities of color, mostly African-American communities, experience pollution at a higher rate than any other racial group. And because of this, you see respiratory problems, you see increased asthma in adults and children, You see increased chronic obstructive pulmonary diseases, so breathing difficulties. And this is important for what I'm going to say in just a minute. So if we can go just a little faster. And hi, Nana, we can go just a little faster. So these are just pictures I wanted to show you. This is, if you look, well, not that fast. But
okay, I'm sorry. I'm sorry, no, okay. All right, doctor. Okay, African town, all right.
So I'm from Mobile, Alabama. And this is about 7 minutes from my house, Africatown. And Africatown is, of course, where the last slave ship landed in this country, the Clotilde. But it's also home to a number of facilities. Back in the day when I was little, it was International Paper was one of them. And I remember we used to smell the rotten egg smell of sulfur. And we were told that was the smell of money and stop complaining. But a number of people have gotten sick and passed away from a variety of lung issues, lung cancer issues and other issues. And in other words, when they could afford to, some moved away. And so Africatown used to be a neighborhood of, I think it was 12,000 people, and now it may be 2,000. But if you're ever down in Mobile, you should go through there, this historic community. We can go on. Okay, I'm almost finished. So we can skip that one. That's Pensacola. We can go next. So this is Port Arthur, Texas, another one of our partners. And the reason I showed you this is because if you look in the foreground, you'll see that basketball goal because and this is what we see in the next slide too. This is what we see in our communities. You can go on to the next slide. Is that we see this is a playground. This is where children play, right? And this is a football field. This is where children play. So they're breathing this in and day out, at home and at school. So that's very important. We can go on. One of the things that we see, one of the health issues that we see is, you can go to the next one, is asthma. And asthma is unfortunately prevalent in communities of color. And a lot of people want to attribute it to indoor air quality, like using pesticides and roach dander and all of those sorts of things. But in reality, it's a lot about what we breathe in, right? Because, you keep your doors open, your windows open in the summertime or whatever, there's never an opportunity to breathe in clean air. I can't tell you the number of communities I've been to where I may develop respiratory problems just while I'm there. The few hours that I'm there, can you imagine people who live there every day for their whole life? It's amazing to me. Next one. So I just wanted you to see if you look at the top line, that is the prevalence of asthma by race. That's all I want to say. The top line should tell you I think it speaks for itself. So we can go on to the next slide. And I just wanted to quickly describe African-American health. We're 50% more likely to have heart disease and 40% more likely to die from any disease at an early age. 19% of us can't afford to see a doctor. I'm going to tell you why this is important. We can go on to the next slide. COVID-19 and susceptibility. So we're not susceptible because we're Black. We're susceptible because of structural racism and structural vulnerabilities, okay? So it's not the color of the skin. And of course, earlier we heard about some misinformation that was provided, that had been provided. No, initially people were saying, oh, Black people aren't at risk from this. And I actually heard on the radio that because we had melanin, we couldn't get COVID-19. Well, I think the data has proven us wrong. Now, all those things that I've told you, respiratory issues, heart attack, and the various cancers that we have from environmental exposure, those are, to me, very important factors towards our structural susceptibility. Of course, along with, we have one of the highest incidences of obesity and diabetes also. So some that plays a role also. But I wanted to tell you this so that I could show you the next slide, which is CDC's guidelines. And this is their updated guidelines. people who are at risk, people who have chronic lung disease, serious heart conditions, severe obesity, diabetes. Those are us. You know, that is us. And the reason we are in the position we're in is because of the situation that we're in, is where we've been living, where we've been, I guess, directed to live in the past. And so, this is very important. And we need to recognize that it's not because it has nothing to do with us being not following guidelines, not following rules, although we all should be, but we're not the only ones who aren't. Because I can sit outside on my deck and just see a variety of people who act like it's any other day, any day in April, not any day in April during a pandemic. But it's important for us to know what makes us more at risk. It's the situation that we've been put in and the historic oppression, repression, depression that we've experienced. And my last slides were, I wanted to this is interesting for me, so I wanted to share it with you guys, because I'm in Maryland right now. And the next slide. So I wanted to give you a snapshot in Maryland. So right now, there are about, last night, okay, there were 15,737 confirmed cases of COVID-19. Today, when I checked again, there were 16,616 cases of COVID-19. There were 680 deaths counted yesterday. Today, there's 723 deaths and 75 of additional probable deaths. And now we can move on. Now, Prince George's County, which is where I live, has the highest incidence in Maryland, which is kind of scary. Yesterday, they had 4,141 confirmed cases and 141 deaths. Today, they have 4,403 cases and 147 confirmed deaths. We're only a very small portion of the population. So that's a concern. That is on the next slide, if I'm not mistaken, or maybe not. This is the range of deaths. So look at the orange. Of course, that's African American. And yesterday it was under 6,000. It was 580,000. Today it's 6,046, right? And that's just the number of cases. For our white residents, yesterday was 3,662, almost half of ours. Today is 3,830. So Maryland is not flattening out. We're still going up, you guys. While people are wanting to open businesses, people are talking about that here, but you can't. I don't know whether it's, the number of deaths remained constant for African Americans from yesterday to today, and actually went up for our white counterparts by 17 additional deaths from yesterday to today. So my final slide, it should be my final slide, is before we go back to the rest of the presentation, I wanted you to know, because this is part of what we're talking about, policy. Why is the data important? Well, there's this scientific principle that we follow, that everybody should follow who works, in the sciences, is when you have, in the face of uncertain or suggestive evidence of adverse environmental or human health effects, regulatory action is necessary. And I bring that up because I showed you the CDC guidelines. Those are the updated guidelines, you guys, from day before yesterday. Did you see anything about African Americans in there? No. And all the data we've had has shown that African Americans are dying at a higher rate, are being infected at a higher rate. And yeah, part of that is we don't have health insurance. Another part of that is that we're not getting tested and we're not getting the same quality of medical treatment. So those are things that we need to focus on. And I think we're going to talk more about that now. So I'll stop. Thank you for sharing my slides.
All right.
Thank you so very much for your presentations. I've got a few questions that I'd already prepared and spoke with you all about, but I think it'd be robbery if I didn't ask the questions that our audience.
Well, I think the pastor has some more slides, don't you?
Yeah, but I mean,
Oh, I
he had a
apologize,
question.
Pastor. No, you
No,
go
no, no.
ahead.
Let's get those questions out. Come on.
I
I can
didn't
always come back
realize
to
you had more slides. No, go ahead. You may be able to get some of this.
Okay. Let me see where we're at. Well, actually, I was just going to share some of the statistics in Illinois, uh, and I'll just show that slide real quick, and then we can have some more conversation.
Okay.
Okay, can you see that?
Yes.
Okay, so as of April 17th, when we did these, when I was putting this presentation together, 6,082 Blacks were diagnosed in Illinois with COVID-19, and 6,939 whites. Then the Hispanics was 4,179, and 7,188 left blank. The interesting thing here is that we're only 14% of the population in the state of Illinois. And so you can see the obvious disparities, and these numbers are increasing drastically. And so the alarming thing is the death rate, whereby as of April 17, 2020, we represented 40.2% of the deaths that occurred in the state of Illinois, being only 14% of the population, with whites represented 39.2% of the deaths, being 54% of the population, and Hispanics represented 9.61 of the deaths, being representing 16.8 of the population. So as Dr. Hollis was clearly pointing out, we have to look at these numbers and trace them back to why Blacks are dying disproportionately to everyone else. And we know that it's because of our lack of access to proper health care. We were on a call yesterday with the city of Chicago because the zip code that I live in, 649, in the city of Chicago, South Shore community is experiencing a very high rate of COVID-19 as well as deaths. And a slide that they put up, and I wish I had it with me, was that they tied hypertension to the lack of access to food. And so both of those columns were equal in the relating to COVID deaths. And that was interesting also. So now we can see that in our community, we had a food desert for the last 6.5 years. And we finally got a food market just 4 months ago. But that shows you what happens when communities of color are lack being addressed or lack access to the other things that other communities have. And when the COVID-19 came, it just unveiled those great disparities, and it was real clear. And so I want to get to those questions because you had a couple of great questions that you wanted to ask. So let's go ahead and deal with those questions. I wanted to show you that.
Well, let me give you this question first, because I think it actually speaks to both of you all, your presentations, in particular when it comes down to Black folk and looking at the disparities in the healthcare system, but also our personal responsibility as well. Felicia Davis says, we tend to respond negatively to suggestions related to personal responsibility. However, our habits, diet, exercise, drinking, drugging, things that we can control, and things that we can control, as is how we and our children spend time and money. Why focus more on others than ourselves? And do you think we will change racism? Would economic success increase justice?
Mm.
You,
Wow. That's a wow moment there, because you, and I'm gonna let Dr. Hollis handle some of that, but listen, when you throw all of that out in the mix and saying, you know, because now you're saying that we're self-abusing. So that basically says that you guys are self-abusing, and so you're getting what you deserve because of drinking, drugging, bad habits, bad eating habits. But a lot of that is related to the conditions we find ourselves in. There's a lot of hopelessness in our communities. And so we have vices. We pick up these vices to try to relieve some of the internal suffering. You know, there's so much suffering in our communities. And so, and then there is, you know, I can have a whole nother conversation on how drugs are prevalent in our communities and how bad foods are prevalent in our communities, and how the media entices us to feel that this is, you know, to live the best life, you need a corona instead of the COVID-19. You know what I'm saying? So they entice us with all types of advertising to make us feel that this is the life that we need to live. And then the entertainment sources, what we've been fed on our TV, suggests that this is the best way to live. Live your best life by destroying your life. And so that's just that's heavy. So I don't want to try to divert the blame, because I am about self-responsibility, but it goes back to education, and we have to educate. We have some generations that are moving forward completely uneducated on how to really live. You know, we need to go back to some big mama, big papa education, where we understood the value of family, the value of food, the value of eating right. And those things have been stripped away largely from good portions of our community. And so I'm going to step back for a second, because I think Dr. Hollis is going to have some good stuff to say on that right there.
well, the first thing I'm going to say is that, you know, I reject the premise that it's our fault. But I will say that the environment that we find ourselves in, where we don't have grocery stores, so we don't have access to healthy foods, we don't make enough money so that we can buy healthy foods, because it costs money to be healthy, y'all, trust me. Mm-hmm. The fact that we can't go walking in some instances because we don't live in that environment. We live in a confined space. We live in public housing in some instances, but everybody doesn't have access to, and this is part of the structural, infrastructural racism, right? We don't have sidewalks and bike lanes. I'm looking out my window because I keep thinking, when we are a little more gentrified, we'll get some bike lanes over here, you know, which is a good thing, but we don't have that as a community. So yes, there is responsibility, but think about this. You have somebody who's obese. What are they eating? What do they have access to? The corner store? You know, they don't have access to the lean parts of the meat or vegetables. So, you know, I'm sorry, I get a little upset because that's what we've been told all our lives. The reason you're sick is because of how you live. No, it's because of where I live. Okay, so I'm leaving. And I didn't get the second part understand the second part of that about justice.
Rev Michael, I was on a panel and somebody posed a similar question about why African Americans don't care about, you know, the earth and all of the environmental stuff that we are involved in. And I just had to really make it plain. I said, let me help you out. You know, we're in survival mode in the African American community. We are the endangered species. I mean, so before we talk about the butterflies and birds and the certain plants, let's talk about the endangered species that are trying to survive from day to day. And not only due to gun violence and drugs and things that have been put in our community to destroy us, but just the fact that there's a lot of hopelessness, the jobs have been pulled. You know, COVID is really exposing a lot about our society, because now everyone's panicking that 26 million people are out of work and they have to rely on unemployment income. Well, you know, that's a reality in the Black community. Don't you ever feel that the 3.4% unemployment rate was really attributed to the African American, because I know a whole lot of young men that can't find jobs, and they can't find jobs because they have a record. They have, and people shun them because they got arrested and they have a felony on their record because of a drug offense or something like that. And so, you know, our reality is so much different than the world's reality. And so I just continue to say, listen, you walk a day in my brother's shoes, then you'll be able to speak. But until you do that, you might want to refrain from making statements like that.
Yeah, Marvin Gaye had a song, and in the song it said, "Make me want to holler, throw up both my hands." Mm-hmm. And you know, when you look at environmental stressors, those are the things we often overlook. We live under, but we often overlook because we've lived under them our whole lives, and for some, we've lived under them for generations. Mm-hmm. Yeah. And those environmental stressors count. Yeah. When you look at, you purchase a house and at no fault of your own, you now live in this pollutant environment, and your house costs less than is worth less than you have to pay for it. That's a stressor. Make me want to holler and throw up both my hands. Mm-hmm, mm-hmm. You see what I'm saying? You mm-hmm. go to sleep at night, and all throughout the night you hearing trucks and you hearing cars and you hearing folks honking and you hear. That's a stressor. Make me want to holler, throw up both my hands. Mm-hmm. My children go outside. They were born healthy, but they go outside and now they got asthma and they got breathing issues at no fault of their own, all because they want to be children and play. That's a stressor. Yeah. And so, you know, I can see how we have these stressful issues that aren't attributed to us, contributed by us. They're attributed to us or put on us, but we didn't start it. And we have to look at this thing systemically. And when you look at it systemically, you find out that we ain't at fault for a whole lot of this stuff that's happening. Mm-hmm. Even when it comes to the things that we put in our bodies. Because I amend the term food deserts. I don't think we have food deserts. I've never experienced food deserts. I've experienced food apartheid. Yeah. I can jump in my car and go get some fresh food.
But everybody can't.
Right.
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 Yeah. I mean, what was? Yeah. I mean, think about the essential stores that were open. Why was the liquor store listed among that? You know what? Right. That has always, like, why was that one of the most essential, as opposed to some of the other grocery stores that closed, or, you know, other places where you can get your medication and things like that. So, yeah, you know, those are, it is the environment. I'm not, you know, and it's not making excuses. It's recognizing where we are. That doesn't mean people don't want to do better. It just means they're recognizing. You have to call it what it is. We can't forget the past. We go from here to better, but you go with that history. That's a part of it.
Yeah, absolutely. Okay. I agree. So the EPA, as you know, has just recently tucked tail and hid up under a rock somewhere while all this going on, and allowed for industry to just go ham. And Pastor, as a policy director, in the age of COVID, when we locked in the house and we can't really do much of anything physically, what can we do to still advocate for the health of communities?
Well, again, you can use this virtual platform to do a lot of work. And I think now more than ever, we have to make connections, look at legislation that's being considered. You know, again, we passed this stimulus package, and then they just said that the president signed another $458 billion relief package. But we got to pull back the onion and see if that relief package is actually going to address the needs of the communities that are at risk. Any stimulus legislation must be people focused, and people focus on the ones that have been underserved. So stimulus language should address underserved communities. Stimulus language should promote clean energy protection and also promote clean energy jobs. Stimulus language should provide resources to underserved communities. Stimulus package should provide funding for infrastructure improvement, starting first in underserved communities. And so we got to talk to our congressmen, we got to talk to our local state reps, state senators, our senators. We have to talk to our cities, city commissioners, and say, whatever you pass, if it's not going to help the most endangered, then leave it where it is. Because too often, and we just saw it happen, where small businesses did not benefit from that paycheck protection program. As much as we would have loved to say they did, many small businesses were left out of the picture because they didn't have those long-lasting relationships with banks. And so the big banks looked after the big corporations they had relationship with. Again, I'm not going to try to call Ruth Chris out because, I do like a steak every now and then. But, they got $20 million. And it wasn't until they were embarrassed. Now they want to return the $20 million. You know what I mean? I like Steak and Shake. You know what I mean? But maybe Steak and Shake could have avoided getting $10 million. And again, there was a lot of mom and pop stores and things like that that did not have the relationships with the banks that got left out of the picture. And again, they said they try to put a fix in this round, and I want to see the fix because I want to see some of that funding go to community stores, because after COVID-19, if we lose those community stores, those small businesses in our community, it's going to cause much more despair, because there's already a level of hopelessness in our communities. If those go away, and all we have is the big businesses, then, where is our hope? And so
Yeah.
I'm hoping that we direct legislation towards addressing what we really need to be fixed.
Okay. A follow-up question for you. Communities of faith involved in policy work, where do you see their role in this right now? How can they be involved in particular? Congregations.
Well, since we were on a Marvin Gaye, wake up, wake up, wake up. Okay. Listen, it's no secret, and I bang the drum that communities of faith have to be a part of this policy work, because first of all, preachers, you have to know how large your voice is, and you have to use that a megaphone, especially in times such as these. And so we can't sit on the sideline and allow people to create policies for us that we know work adversely against us. And so we got to make sure that we are a part of the solution. And I always said, if you're not at the table, then you're for dinner. And so we have to really get involved. So I'm a social justice preacher, and so so my church is a social justice church, and so we're in policy. It's no secret I'm policy director for Faith in Place. But Faith in Place put me on because of my work I've been doing in the community for the last 20 years. So the 20 years that I've been in the community, I've been advocating for justice, and people of faith need to be advocates of justice, because if not, then I don't want to let me tie it in. If you're not an advocate for justice, then you're perhaps not following Jesus, because Jesus was an advocate for justice. And matter of fact, I was just reading in Isaiah 61 that the Lord loves justice. He hates wrongdoing. You understand? And so until we understand that the God we serve is the God of justice, and he causes us to be advocates for justice, then we're missing the mark. You just can't, like I say, you just can't shout on Sunday and think you've done something.
Rev, I don't want to cut you off, but I want to give Dr. Hollis last words. But let me preach on your sermon just for a minute. I was just telling somebody a little bit earlier on a panel that when Jesus went in and kicked over those tables and ran them folks out of the temple and declared that my house will be a house of prayer for all people, that was Jesus setting policy. Jesus
Written
was a
policy.
policy advocate. Don't fool yourself. But
That's right.
I want to give Dr. Hollis last words. I apologize that we've run over a little bit, Dr. Hollis, but go ahead and take us home.
No, I'm grateful. I do want to say I agree with everything the pastor said about, you know, being active in the policy range and also electing people who are going to represent you and also and running for office, right? If that's your thing. What I want to remind people of, though, is that when this is over, and it will be over, we're never going to go back to that normal. We need to be a part of what the new normal is going to look like. We also are coming up on climate change, adverse climate effects, and we need to think about what we're going to do and plan for what that looks like if somebody's in extreme heat, practicing social distancing, and doesn't have air conditioning, or is homeless, okay?
Right.
Something like that, things like that and more. But we need to be thinking about that, and I think that is a big role that the church can play, as well as others. You know, and when it comes to getting this stimulus money, let me just say this. We need to be first to apply. There's only a certain pot. And by the time a lot of the smaller businesses apply, the money is gone. We need to be there before the big guys. That's all I want to say. And thank you for having me, and I've enjoyed it.
Thank you. And as Pastor Onque said, get to the table. Because if you ain't at the table, you on the menu. Get to the table. We need to collectively get to the table. Thank you all again for being with us.
Thank you
for
Thank you, Reverend.
your encouragement. Thank you for your inspiration, as well as the knowledge that you gave. Thank you, audience members, for being with us. Understand that I will be sending the recording to all those who registered for this. And thank you to Earth Day Network, as well as our other partners who've been a part of this Faith Call to Climate Justice Web Summit. Peace, love, and light.